now is Dr. Dale Kalina, an infectious diseases specialist and chief medical information officer at Brant Community Healthcare System. Doctor, thanks as always for joining us.
Good to see you, Roger.
Talking about the norovirus, that's a completely separate issue. It's a nasty thing, but we're also talking flu season is here, RSVs are here, and they're here in a hurry, aren't they?
Yeah, they really are. So when we think of winter viruses, we think primarily of respiratory viruses, with respiratory virus season kind of getting a kickoff at the very end of December here in Canada. But you're very right to say that we also think of gastrointestinal viruses, such as norovirus, which is causing that outbreak of viral gastroenteritis at the University of Guelph. And I completely agree with Dr. Mercer. It's awful, but this is the type of thing, both with the respiratory viruses and norovirus, that we see on a yearly basis. It always increases around this time of year.
How do we know how do we tell the difference between the two? When you have something, how do you figure out what it is?
So with norovirus, it's very obvious. You get vomiting right away and then usually diarrhea afterwards. That's why it's so important to wash your hands when you're worried about viral gastroenteritis. But when we're talking about respiratory viruses, that's when it gets a little bit trickier. Of course, there's a lot of differentiating symptoms, whether you have a runny nose or a sore throat, shortness of breath, things like that. They can all be caused by COVID, influenza, RSV, cold and flu viruses. But the reality is, when you have any one of these viruses, you are contagious, and it would be important to A, stay home, B, wear a mask, especially around other people that you know and love, but also take care of yourself and don't go out and about. It's when you start to have really severe symptoms, particularly with the respiratory tract infections, of shortness of breath and things like that. That's when it's really important to seek healthcare providers. And with norovirus, if you can't keep up with oral intake, like eating and drinking at all for longer than a few hours, that's when it's also important to seek medical advice.
And are we seeing more people since the pandemic wearing masks at times like this?
Well, we were. For a long time, of course, we didn't see any flu or cold viruses almost at all through 2020, 2021 because of the use of masks. And so it really is a reminder of the fact that we all know how to use masks. We know how to prevent viruses from infecting others that surround us. But I think sometimes people are embarrassed to do that. We wear masks all the time in healthcare. We wear them on a regular basis, whether if somebody is themselves sick and have to work, for example, or disappointingly, or of course, if somebody that we're caring for has an illness, we wear them to prevent us from getting sick as well. And this is something that really was something that we saw in the general public throughout the pandemic, and it's something that really needs to continue. Wear a mask if you're feeling unwell and you have to go out. This is a courteous thing that we can do to help protect people around us.
Are we seeing a surge then in all the viruses right now?
Yeah, we are. So we would expect to see more and more influenza, particularly at this time of year. It's really starting to take off. Interestingly, we have already seen fairly high levels of RSV. It seems to be about stable right now, and COVID-19 or SARS-CoV-2 virus also appears to be fairly stable right now. They're both high, and particularly with influenza and COVID, of course, those can lead to hospitalizations and really severe outcomes and even death. In fact, I think in Ontario, we had something like 8 deaths associated with COVID-19 last week. So we do have all of these respiratory viruses, and the numbers are increasing across the board.
And just before we go, what can you do to protect yourself? Are there any of the old wives' tales that actually work?
Well, I think beyond old wives' tales, the things that we can do to protect ourselves are, of course, vaccines against COVID, RSV, and against influenza. And it's not too late to get them. So go for it, get your vaccines. But with respect to the respiratory viruses, wearing a mask, avoiding other people, don't sneeze in other people's faces or cough, and wash your hands. And washing your hands, I highlight, is really important, particularly for norovirus with soap and water, because alcohol-based hand sanitizer doesn't really work against norovirus particularly. And then, of course, cleaning handles and bathrooms and things like that with bleach, particularly important with norovirus.
Okay, Dr. Kalina, thank you as always.
Thanks again, Roger.